name's Travis Alexander. I'm a medical humanities postdoctoral fellow at Rice University. I'm joined here today by Samantha Allen, who's an assistant professor of English and chair of humanities at William Penn University. Dr. Allen is the author of Writing Contagion, American Life Writing in the Medical Humanities, out in 2020. And she's here today to talk to us a little bit about some new work about media literacy around COVID-19. So with that set up, Samantha, do you want to tell us a little bit about the scope of your research around COVID and media these days?
Yeah, so my work is called Media Literacy in Epidemics, Medical Humanities, and Public Health Narratives. And I was really inspired to start talking about this when I taught a media literacy class for my undergrads here at William Penn. And one of the things we were really talking about was COVID and why there's so much misconception around it, why people are hesitant to be vaccinated, people choose not to believe in the pandemic at all. And that was really sort of the question that kind of took over our semester. And so I didn't have a lot of great answers for them. And I don't think anyone really does right now. But when I started thinking about media literacy and epidemics, I started doing a lot of research into science journalism, and that a lot of science journalism isn't reported very accurately. So we get a lot of like snappy headlines about dark chocolate preventing cancer or like misrepresenting data about new diets, but we don't get a lot of information about actual scientific studies. We don't get a lot of information from public health officials. So a lot of the science that we are exposed to through the media is just really sort of snappy headlines. And so I was really interested to sort of see how this affects public health and how this sort of like has a historical precedent. Because I was imagining, before the internet, I was imagining science literacy probably wasn't much better. And that is what I have found so far. So media literacy and epidemics really sort of wants to explore the reasons why medical communication fails. So why people are hesitant to trust medical professionals or public health officials, what kind of impact these failures have on people's lived experience with disease, especially COVID. And then I sort of look at how the medical humanities, particularly how storytelling about different illnesses and conditions can really help improve people's media literacy about epidemiology and public health.
Can you say a little bit more about, in particular, your conception of storytelling, and maybe, I know you're trained as a literary critic. Can you talk a little bit about some of the methods that you use and maybe that we learn in more of the literary sciences that you think would be especially applicable to a wider audience?
So my real focus has been, so for my doctoral dissertation and for my book, Writing Contagion, I really wanted to look at the history of illness narratives and how illness narratives are part of American literature. And the idea was that people have been writing nonfiction stories about illness for as long as American literature has existed. And so I was sort of putting together early history and found that before the 1950s or so, people really didn't talk very much about medical conditions. There are cases, there are definitely illness narratives out there. There's a couple around the 1918 influenza pandemic, but really a lot of people started talking around the polio epidemics. FDR, for example, really got people more comfortable speaking about polio. It was less of a sort of a hidden disease and something that was more okay and socially acceptable to talk about. And then when HIV and AIDS became an issue in the 1980s, there were even more memoirs there. And so really what I was focusing on and how I look at illness narratives is sort of how people tell illness narratives using conventions of memoir. And so as memoirs became more and more sensationalist starting around the 80s and 90s and became more salacious and trying to have more detail to get people interested, that sort of changed how we tell illness stories. And nowadays it's we have plenty of illness narratives, memoirs about all sorts of conditions out there, and people are more comfortable talking about that. So when I think about media literacy and I think about storytelling, I think about how we are less encumbered with sort of the idea of like politeness or what's socially acceptable and are okay speaking openly about medical issues. I mean, there's still a lot of stigma around a lot of medical issues, but much less so than there were 50 years ago, for example. So that's sort of what I look at with COVID, how people are sharing their stories online. I'm currently working with a documentary film crew. They're called the COVID Survivor Diaries. And their project is they're interviewing people in all 50 states about COVID and telling their stories. And people are very open about telling their stories. They will give the details, even the gross and not really fun ones. So we get a lot of really vivid and graphic depictions of the disease. And my argument is that we need these kinds of narratives to help combat misinterpretation and misinformation about COVID.
Yeah, that's really fascinating. I hear that what you're saying is that the rise of detail and the rise of even anatomical accuracy that enters the memoir genre, as you say, especially in the 80s with HIV/AIDS narratives, I definitely can understand how that helps to destigmatize and demystify illnesses and take them out of the purely metaphorical or figural realm. But I wonder, do you think, do you observe any cases where that, as you called it, even that salacious quantity of detail and even the turn to disgust, has that had any negative effect on our ability to understand pandemics in their full scope? I mean, is there almost a risk of romanticizing or hyperbolizing the experience of pandemics and disease that way?
Well, one thing that I do think happens is when you're expecting these really graphic depictions of how terrible disease is, the people who do not have those stories, the people who have stories, like me, I had COVID and I was not particularly ill. I was pretty okay during it. And I feel like that some of those stories get silenced, or people are expecting the worst of the worst. And so the average kind of story, the normal kind of experience, if there is a normal, I don't like to use that word, but those things sort of get hidden. And I do think there is sort of a romanticization about it. I mean, we all want this sort of like hero journey with the medical illness. We want someone to get super ill, be on the brink of death, and then like come back and rise as sort of against all the challenges given to them and sort of really overcome. We want to use that word, sort of the illness there. And so I think there's a certain kind of like expectation that we do give these narratives. And when the narrative doesn't live up to that expectation, either like perhaps a patient dies or perhaps it's just not that severe to begin with, I think that sort of lessens like the impact that these have. And I also think part of the problem with telling stories, although I think stories can be a really great way to reach people and can really combat misinformation, I think at the same time we have to be careful about relying too much on anecdotal evidence with stories. And so stories that sort of back up like what's going on with facts, statistics, or any kind of like medical narrative as well, something written by a medical professional, I think those are going to have a little bit more impact as well.
Could you give our listeners a few examples of memoirs from any historical period or national tradition that you think do an especially good job at depicting a more accurate or diverse experience of illness, ones that maybe eschew that hero's journey arc that you say is so clouding in its impact on the genre? Just some particularly interesting or diverse examples that come to mind for you.
So the first one that comes to my mind is actually not about an epidemic, but it's Lucy Graley's autobiography of a face. It's a story of a young girl who gets cancer, which leaves her face, I'm trying to find the right word here, but leaves her face with a lot of significant marking on it. And so she has to sort of come, sort of like deal with this and sort of like deal with, I want to put this in quotation marks, being ugly or not being what people sort of expect her to look like. So dealing with a whole bunch of surgeries to sort of reconstruct her face. And it's a really interesting story because it's not the something bad happened to me, I got over it, and now I'm better sort of narrative that I think we're really used to. Instead, it's more of a real complicated look at here is illness. Here is sort of the difficulty around illness, and here's where I am now. And Lucy Graley actually did die by suicide a few years later. So it's not some sort of hero's journey. It's a really sort of like a sad look at how cancer can really affect people. And so I think that's a really good example. Another example that I teach pretty frequently, it's actually written for a younger audience. It's Peg Carrot's Small Steps, The Year I Got Polio. It's written for a older child, young adult audience. And it's a story of a young girl who gets polio. And at the end of the story, she does take a couple small steps, but she's not cured. And then she writes the epilogue where, she has to continue physical therapy for the rest of her life. and how she's going to have these problems. And then the other people in the story here, other polio patients who were in the hospital with her, one of them dies. Another one never gains the ability to walk. So it's definitely sort of challenging that we have to overcome these issues and like be the model disabled person. It's not like that. And so I think those are two pretty good examples.
And then just maybe by way of conclusion, can you point us to a few ongoing projects you've got or forthcoming research that we can be on the lookout for in the next couple months?
So right now I'm continuing working on media literacy and epidemics. I actually work with Synapsis as a health humanities journal, and I'll have a piece out this December sort of talking about media literacy and how medical humanities can help media literacy. So that's sort of the next thing I'm working on. I'm hoping to have this book project out in the next year or two. Part of the problem is that doing research on COVID is hard because research on COVID is ever changing. So some of the historical information has been written, but I'm still waiting to sort of see how the pandemic shapes up, and it appears that we'll be continuing on for quite a while here. But my next work will be in Synapsis.
And just real quick, can you mention again the name of the documentary crew that you said you were working on that's going state to state?
They're called the COVID Survivor Diaries.
And are they searchable under that name online, or has the material been published yet?
Yes, they have a blog with published stories right now, and the documentary is forthcoming.
All right. Well, thanks again to Dr. Allen for visiting with us today, and I hope you'll check out more of our interviews in the next few weeks. Thanks, everybody.